Bismillahir-Rahmanir-Rahim. A'udhu billahi minash shaitanir-rajim. I start with CME with the name of Allah, the most beneficial and merciful. CME update by Mother and Child Survival Group of Pakistan. Me, Dr. Tariq Masood Khan, Gynae Family Emergency Specialist, Gulf KSA, presently working as district gynecologist in a district's general hospital setting. Brief review of the overactive bladder OAB, which is just the contraction of the Betroser muscle with urgency, with or without urge incontinence, nocturia. There are many underlying causes for it, and the important is to diagnose this important condition, which causes great deterioration in the quality of life because of unpredictable leaking, especially at night. Infection, no doubt. Infections are the most common of the urinary tract, and then there are neurological causes, multiple sclerosis, and as well as other neurological problems. And then can be provocative causes as well, but the most important are the local causes and infective causes and neurological causes. How can we diagnose? It is diagnosed through, as I have told you, by the frequency volume chart, as there is increased frequency in the night and increased nocturnal frequency, and then there also bladder diary, which is maintained to see how much leaking is there in the bladder, and checking leakage on the pad. Then important is the urodynamic testing, which will tell you the overactive bladder Betroser muscle contractions, especially in the involuntary phase of the urethral cycle. In the mixing phase, shows increasing Betroser contractions. Then there are other causes as well, metabolic causes like diabetes, physical causes like prolapse and others, and infective causes like urinary tract infections. So how to manage this condition of increasingly leakage of urine with and without urge incontinence, and there is urgency and nocturia as well. We can have a lifestyle modification, most important one. Start from the simplest therapy, progress to complex treatment modalities. As I have told you, the simplest one is the lifestyle modification. Decrease, we can have 1 to 1.5 liter. Avoid tea, caffeine and other drinks and alcohol, and exercises, especially those are the one in which the pelvic muscles are strengthened by the pelvic exercises to increase the duration of boiling and upholding the urine, increasing the intervals. And then there are other therapies like acupuncture and the hypnotherapies. And basically we have got pharmacological management, in which we have got this drugs, parasympathetic drugs which blocks the parasympathetic nervous stimulation. In the urodynamic test, as I mentioned, that it is the mixing phase of the involuntary increase in the detrusor contraction during the filling phase of the urodynamic testing. Maximum pressure, inter-abdominal pressure minus the intravesical pressure gives you the detrusor pressure. So as I've told you, there are a lot of modalities of the drug. Most are the parasympathetic drug, but we have to, first important is to have the side effects of the parasympathetic drugs, like blurring of urine, constipation, urinary retention, and etc. And we have done relative contraindication to these drugs, like we have to sort it out: gastroenteritis, enterocolitis, ulcerative colitis, and this myasthenia gravis, and acute angle closure glaucoma. The drugs mentioned are: number 1, the trospium, tolterodine, piperine, solanofacine, terifenacin. These are all the drugs which are used accordingly. Then among them are tolterodine is the best one, which is best tolerated drugs. And then in individual variation, which drug is going to be is likely to be accepted by the patients. Then surgical management, if the conservative management have failed, there is also a role of botulinum toxin for the neuromodulation of these detrusor muscle. Botulinum toxin is injected after an interval of 6 to 12 months. Repeated injections are required, and with this reduce and slow the contractions of the detrusor. It's a very effective one, and sometimes it can give relief to 90% of the patients. Surgical treatment refractory to medical and this botulinum toxins. If these medical conservative measures fail, then can go for surgical treatment, which important are the augmentation cytoplasty, detrusor myomectomy, and urinary diversions. Also, as I have mentioned, also neuromodulating drug like botulinum toxin to block the detrusor overactivity. This is a brief review, and takeaway lesson is: pray, praise, trust, love Allah, worship Allah, talk about Allah, and follow the lifestyle of Hazrat Muhammad sallallahu alaihi wasallam. is our health and survival, and we should not forget our glorious past. हज़ारों साल नरगिस अपनी बेनूरी पे रोती है, बड़ी मुश्किल से होता है चमन में दीदावर पैदा। दहर में इसमें मोहम्मद से जाला कर दे, हम तो माइल बकरम हैं, वो साइल ही नहीं। राह किसको दिखलाएं, राहबर मंजिल ही कोई नहीं। वो मुअज़्ज़ज़ थे दुनिया में, हम ख्वार हुए। वो मुअज़्ज़ज़ थे दुनिया में मुसलमान होकर, और हम ख्वार हुए तारिक कुरान होकर। वमा अलैना इल्लल बलाग, विल कम विद अनदर रिव्यू। खुदा हाफिज़ और up till the next CME.